Section 1. Introduction. Recognizing the signs. The nurse's role. As a nursing student preparing for the NCLEX, you will encounter patients with a wide variety of symptoms affecting their eyes and ears. These symptoms are often the first clues that something is wrong and that medication may be needed. For the eyes, patients might complain of persistent ache, sharp pain, a frustrating blurriness that makes reading difficult, seeing halos around lights. Their eyes might appear red and irritated, or extremely sensitive to bright light, photophobia. These signs can point to conditions like glaucoma, where pressure inside the eye builds up dangerously. Ear-related symptoms require careful attention. A patient might present with persistent ear pain, discharge, a constant itching sensation, or a feeling of fullness. These symptoms often signal an infection or inflammation that requires topical treatment with eardrops. Understanding the pharmacology behind these treatments is fundamental to providing safe and effective patient care. Glaucoma, a group of eye conditions that damage the optic nerve, is often called the silent thief of sight. This damage is typically caused by high intraocular pressure or IOP. Patients may not notice symptoms until significant, irreversible vision loss has occurred. The goal of medication is to lower this pressure to prevent further damage. One common treatment is a class of drugs called beta blockers. Section 3. Glaucoma, prostaglandin analogs and alpha-adrenergic agonists. Another major class used to treat glaucoma is prostaglandin analogs. They are a very popular first-line option, highly effective and typically used once a day. That once daily dosing improves patient adherence. Their primary mechanism is increasing the outflow of aqueous humor. Specifically, they enhance the uveoscleral outflow pathway. By opening that drainage, intraocular pressure is lowered. That relieves strain on the optic nerve and helps preserve vision long-term. A classic example is latanoprost, brand name Xalatan. It's usually given as a single eye drop in the evening. When teaching patients about latanoprost, manage expectations about cosmetic side effects. This is a key NCLEX counseling point. Irreversible eye color change, blue eyes, green eyes, hazel eyes slowly turning brown. Other common effects are changes to the eyelashes, lengthening, thickening, darkening of the eyelashes. You may also see darkening of the skin around the eyelids. And some patients experience eye redness or a stinging sensation. These effects are usually localized and don't carry the systemic risks seen with beta blockers. Carbonic anhydrase inhibitors reduce intraocular pressure by decreasing the production of aqueous humor. This class is available as topical eye drops like dorzolamide for long-term management or as oral tablets like acetazolamide for acute situations. Side effects can include stinging and a bitter taste with drops or tingling in the hands and feet with oral tablets. Meiotic agents work differently. They constrict the pupil, which pulls the iris away to open the drainage angle, increasing the outflow of aqueous humor. A classic example is pilocarpine. Because it makes the pupil very small, common side effects include dim vision, especially in low light, and brow ache. Mydriatics sympathomimetics causes pupil dilation, allows for retinal assessment. Example 1. Phenylephrine. Mydriatics. Watch for intense photophobia and bright light pain. They may raise intraocular pressure, trigger narrow-angle glaucoma, and cause reflex bradycardia. Example 2. Atropine, a classic cycloplegic. Cycloplegic side effects, severe blur and loss of near vision, increased IOP plus dry mouth, constipation and tachycardia. Cycloplegics and anticholinergics dilate the pupil and paralyze the ciliary muscles. Examples 3 to 5, cyclopentolate, tropicamide and homatropine. Additional anticholinergic cautions, photophobia, blurred vision with poor accommodation, increased IOP, avoid in narrow-angle glaucoma, plus dry mouth, constipation, urinary retention and tachycardia. Otolaryngologic pharmacology, topical steroids combined with antibiotics or other drugs, used when inflammation is present. Examples: acetic acid plus hydrocortisone, carbamide peroxide, ciprofloxacin plus hydrocortisone. Side effects: ear irritation, stinging or burning, dizziness. Now let us learn how to administer eardrops in children. Defined as a child under the age of 3, requires a specific technique to ensure the medication reaches its intended target within the ear canal. The anatomy of a young child's ear is different from that of an adult. Their ear canal is angled differently. The key step in the procedure for a child under 3 is the direction in which you pull the outer ear, or pinna. You should gently pull the pinna down and back. First, warm the eardrop bottle in your hands. Have the child lie on their side with the affected ear facing up. For children under 3, gently pull the pinna down and back to straighten the ear canal. Hold the dropper about half an inch above the ear and instill the prescribed drops against the side of the canal. Keep the child in this position for 3 to 5 minutes. You can gently press the tragus in a pumping motion to help the medication move deeper into the ear canal. Providing a small distraction, like singing a song or talking to the child calmly, can help keep them still during this time. Proper documentation and patient education are the final steps. After the procedure, record the time the medication administered the ear. Right, left, both, and the child's tolerance of the procedure. If you are teaching a parent how to do this at home, use the teach-back method. Explain the steps clearly. Warm the drops, pull the ear down and back, and keep the child lying on their side. Then ask the parent to explain the process back to you in their own words. This confirms their understanding and empowers them to provide care safely and effectively for their child at home. A clear illustration often helps show a nurse pulling a small child's earlobe down and back to administer eardrops. When administering eardrops to an adult or a child aged 3 and older, the technique for straightening the ear canal changes. First, warm the drops in your hands to prevent dizziness. Position the patient lying on their side with the affected ear facing up. For this age group, gently pull the pinna up and back. This straightens the S-shaped adult ear canal, allowing medication a direct path. Hold the dropper above the ear canal, taking care not to touch the tip to the ear to prevent contamination. Aim the drops along the side of the canal. After administration, have the patient remain in this position for 3 to 5 minutes to ensure the medication penetrates deeply. You can place a cotton ball loosely in the ear opening to absorb any excess. In pharmacology, safety is the highest priority. For eye medications that dilate the pupil like mydriatics and cycloplegics, always ask if the patient has a history of narrow-angle glaucoma. Dilation can trigger an acute angle closure crisis, a medical emergency. Warn patients about photophobia and advise them to wear sunglasses and avoid driving. For ear medications, a crucial safety check is to confirm the eardrum is intact. Some drops are ototoxic and can cause hearing damage if they enter the middle ear. Remember the technique. For children under 3, pull the ear down and back. For everyone else, pull it up and back. Always warm the drops to body temperature to prevent vertigo.